Hi, I'm Nat Vonthein and I'm part of the Student Success Centre. I work in the Inclusion and Accessibility Service, and we're here to provide direct support to students who might be living with disability, a medical condition, illness, injury or mental health condition. We also provide support to students who are carers or people who are breastfeeding, pregnant women while they're enrolled in their studies. We provide support in a short-term capacity but also ongoing for all students while they're enrolled with their studies. We work with students to make sure that reasonable educational adjustments are in place to help you achieve your academic goals. In reality, this can mean accessing support from a wide range of different kinds of services. For example, you may need changes for online tests or for your exams. You may need assistive technology or specialist equipment, or you may need your learning materials provided in a different kind of format. So for example, for nursing students, you may have a hearing impairment, you may need an amplified stethoscope, you may need particular software if you're living with dyslexia to help with written assignments or exams, or if something happens to you just before an exam, for example, you've just broken an arm, you may need a scribe or you may need access to a computer. We can put in place all of those kind of supports to help you really get the most from your studies. The support can really vary from individual to individual, depending on what you're living with. So we really encourage you to speak to a disability advisor to see how we might be able to assist you. If you're thinking about registering with the service, we encourage you to download our registration form from our webpage, and that will ask you to speak to a treating health professional to help us really understand how what you're living with is going to impact on your studies. We'll then meet with you and discuss with you the kind of support the university might be able to make to help you. And that can cover a whole wide range of different aspects of the learning that you'll experience at the university. In some cases, we may need to liaise with the academic school to make sure that the recommendations can be put in place. And what we'll do, we'll put together an accessibility plan that will detail all of the recommendations that we think are going to be there for the duration of your studies with us. The consultation with a disability advisor might also include discussing residential schools, attending placement and disclosing to the school about your medical condition or your disability and what may be required for you to meet the accreditation standards for your programme. After your intake appointment, we'll put together your accessibility plan and you'll get a copy of this so that you can share it with your course coordinators and lecturers. We really encourage you to have those conversations early. So you can alert your lecturers if you're travelling well now, but your situation may change during the term. I'd like you to remember that support from our service is not just about exam conditions. Students living with mental health conditions may need additional support to cope with anxiety and the added pressures from studying. So we work really closely with the student counselling team as well. Sometimes we work with students who have not registered at the beginning of their studies and they might need support for when study doesn't go according to plan. So for example, deferring exams, applying for assessments, or perhaps if you've had to take a break for a health reason and you're coming back to study later on, we want to be there to work with you to make sure you're going to be able to achieve your academic goals. Your disability advisor will be a point of contact for you while you're enrolled at the university, and we'll check in with you every year to make sure that you're travelling fine and if there's any changes that are needed to your accessibility plan. We work with academic schools about inherent requirements in programmes and inclusive learning and teaching practice. Inherent requirements are the essential components of a programme that demonstrate the capabilities, knowledge and skills that are required for you to achieve the core learning outcomes of the programme while preserving the academic integrity of what you'll be studying with us. In nursing, for example, inherent requirements are going to make it really clear for students to be clear of the expectations that will be required and will help us as disability advisors to have a clear framework of the support that we can put in place to help you achieve your goals. It's also going to be helpful for students to make some informed decisions about being successful with their programs. Studying can be stressful for all kinds of reasons. If you're finding things tough going, ask for help. There's a lot of support available from the Student Success Centre, from us as disability advisors, from student counsellors, from our scholarships team and other student success staff. We're here to help. We understand what students might be going through and can offer solutions to help you achieve your goals. We're just a phone call or an email away, wherever you might be located. To contact our particular service, the Inclusion and Accessibility Service, you can just search disability on the CQU webpage. You can email the team at accessibility@cqu.edu.au, or you can call the Student Success Centre on 074930 9456. We're really looking forward to working with you and helping you achieve your academic goals this year. Thanks.